we are continuing on with our hematology review here. Well, just to throw a question out at you, what are the interleukins involved in the formation of eosinophils? If you remember that chart that we have to memorize, and I know you're very sure about the myeloid and lymphoid progenitor cells and how they grow and proliferate and the interleukins involved. But just to test you, what are the ones involved for the eosinophils? Well, that's pretty easy to remember because they're both interleukin 5. Anyway, make sure you look at that chart before the test. So let's just talk about some basic red blood cell pathology and how would we define anemia. Anemia is the reduction below normal limits of the total circulating red blood cell mass. And this may lead to, for example, what type of reaction in the body? Palpitations, dizziness, skin pallor are some good examples. So when we discuss the anemias, it would be a good way just to think about it as it being a decrease in the oxygen carrying capacity rather than just a decrease in the red blood cells, because you need to have enough blood cells that function and not just enough blood cells. So in thinking about blood loss, you could have acute or chronic. And what would you call it if you'd have increased destruction in a type of anemia? This would be hemolytic. And we'll also talk about the different types of anemias involved in decreased production. So again, what are the features you might see in all of the anemias that might show up? Pallor, tiredness, weakness, dyspnea, palpitations, and heart failure due to high output. So continuing on in our discussion of blood loss, when you talk about acute blood loss, what could this be due to? A simple example of this would be trauma. How about chronic blood loss? This could be due to lesions of the GI tract, gynecologic disturbances, and remember that the features of chronic blood loss anemia are the same as for iron deficiency anemia, as this is defined as a situation in which the production cannot keep up with the loss. So now we're going to talk about impaired production, so you're not making enough red blood cells. So what would be some examples where there would be a disturbance of the proliferation and differentiation of stem cells? Well, for example, aplastic anemias, pure red blood cell aplasia, and renal failure. So you remember that the kidneys produce erythropoietin. So if you have renal failure, then that's not going to be produced. So think about the disturbance of the proliferation and maturation of the erythroblasts. So what would you if you have megaloblastic defective cells, what would this be causing a problem with? This would be causing a problem with DNA synthesis. How about a problem with defective iron carrying ability? This would be due to the problem with heme synthesis, heme carrying the iron. How about the thalassemias? What are the thalassemias caused by? These are caused by deficient globin synthesis. So again, problems with iron carrying ability are due to defective heme synthesis. Megaloblastic problems result from defective DNA synthesis, and the thalassemias are a result of deficient globin synthesis.